Hey Denture peeps. So when I started making content on this platform and some of the other platforms about dentures, it was really my goal to inform denture patients so that their experience with getting dentures could be better, so that they could know what the expectations are, how the process works, how to get through the tough times, how to troubleshoot the tough times. And I really enjoy doing this, and I think that there's another whole perspective that I've been thinking about that I want to share with the denture patients. And that is, what kind of challenges does your provider come up against when they are making your dentures, when they are seeing you and fitting the dentures and troubleshooting? I think that this is very important because I think that the challenges of the patients, we talk about that, and I talk about that all the time, and that is really the importance of my channel. But I think that this is a good insight for the denture patient to know also. So I think one of the biggest hurdles that I come across in my practice with denture patients is an almost ingrained distrust of the provider. I feel like it's something that I have to overcome with the patient right out of the gate. That's, I'm sure, attributed to that patient's prior experiences of going to a dental office. And, I know that all of the dentists in the world aren't great, and all of the denturists in the world aren't great providers. I know that goes into every, practice of medicine, dental, psychology. I know that not all providers are wonderful and compassionate human beings, and that leaves scars on us as patients. But that's one of the biggest things that I really have to overcome with each and every one of my patients when they walk in the door. Some of them have had really awful experiences, and some of them just have an ingrained distrust of somebody wearing a white coat. I try to, make my office very inviting and warm, and I am very, friendly to my patients, but sometimes that just isn't enough. Sometimes I just have to prove it. I have to prove that it's going to be okay. And sometimes my patients are fighting that notion the entire journey through dentures. And I see a lot of that on these platforms as well. And it's not to say that that's the patient's fault. There are so many different things that go into that. But I want patients to also understand that, everybody who has ever gone to a dentist has probably not had a great experience. I've had a lot of dental work, and I don't think that I've ever enjoyed going to the dentist. It's painful. I don't like the shots. I don't like the sense of choking when I have things in my mouth. I don't like even the little bite wings that they put in my mouth to take x-rays. They hurt. I have tori underneath, the insides of my jaw. And I just don't think I ever have a good experience in the dentist. Usually they're very busy and I have to wait for a long time. It's just not fun. Tooth pain is not fun. It's just a very difficult situation for the patient. No matter whether you're a denture patient or you're a dental patient, it is seldom ever enjoyable. So there's always that. That ingrains in us a kind of a post-traumatic type of a syndrome. We don't like to go to the dentist. Nobody wants to see the dentist. I'm not a dentist, I'm a denturist, but that just, it floods right over into my office as well. And some denture patients haven't had great experience with denturists or dentists or the denture making process. And dentures, they're not fun either. It doesn't help that you have to start the entire process with getting your teeth pulled out. That's horribly painful. That's terrible emotionally, physically, psychologically. It is not a fun process. Then you have to get impressions, and so you have to have a big tray of gobbledygook put in your mouth, and half the time you feel like you're going to choke or throw up. It's not fun. And the process is pretty much, not a very known process. So the patient has a lot of questions throughout the process, and a lot of the answers are complicated and hard to understand for a person who does not make dentures. That's why one of the reasons why I started this channel and on the other platform as well, to try to, demystify the entire process so that the patients see what's going into it behind the scenes, so they know why certain things happen. I've had patients who have gotten all of their teeth pulled and gotten an immediate denture, and somewhere else, usually, I explain the process very well, but they will come into my office and they'll say, I got this denture, 4 years ago, and it's loose, it's choking me, I can't keep it in my mouth, it's been a terrible experience. And I'll ask them, how many dentures have you had before this? Is this your first denture? And they'll say, well, yeah. And I'll say, okay, so you got your teeth pulled out and you had this denture put in, and so this is your immediate denture. Yes, this is my first denture. It's been horrible the entire time. Have you had a reline in it? Well, what's a reline? It's when they go in and take new impressions inside of the denture and tighten the denture back up. No. Well, that's probably why your denture is so loose. You didn't ever have it tightened back up. Well, nobody told me that. Maybe they didn't. But when I explained to them, why they need a reline, that their gums were big when their teeth still lived in their gums, and then they had their teeth pulled out and had a denture put in. Now that tissue has to close up, shrink up, the bone remodels and everything changes, the denture is going to be very loose. They are upset by that. They're upset. Well, I don't understand. It looks healed. Well, yeah, but it heals for 6 months. And then for the rest of your life, your gums are going to change. So dentures are difficult. When you first get let's say you had your teeth pulled out, you healed, you stabilized, everything is stable, and you go to get your permanent denture, and it fits well. And you might even have a couple of sore spots. You get those adjusted and everything's wonderful. A year goes by and those dentures are loose. That's not abnormal. That's quite normal. It is kind of a moving target all the time with dentures. So it's hard on a provider like myself. I want all of my patients to be happy. I want to inform them of the process, but those are some of the challenges that I face, is the patient being angry right when they walk in the door. Before they've ever met me, before I've ever even opened my mouth, the patient comes into my office and they're automatically angry. And when you have to have your teeth pulled, that is not a fun process. That'd make me angry as well. And I've had some pulled. It makes me angry as well. But I just want to share this to patients so that they understand that not all providers are bad providers. Some providers are actually amazing providers, and just because you've had a bad experience somewhere else does not mean that you're going to have a terrible experience with your new provider. Attitude is everything. When a patient comes into my office and they are wanting to be happy, and they have a positive outlook and a good attitude, and they are knowing that it's not going to be an easy process, but they are looking forward to it, and they are excited about the prospect of having teeth again and having a smile again. Those cases are almost always more successful than the patients who come in angry. A patient who wants to be happy is much more likely to be happy. So anyways, I hope that gives you a little insight into, the provider's perspective. And if you like my videos, follow, subscribe, share, do all of those things, and shoot me some questions. I'd be happy to talk about them. Okay, have a great day.